Okay, my name is Henry Hu. I'm the Director of Anesthesia at San Francisco Surgery Center. Welcome to my channel. Today I'm going to talk about digital block. Digital block is a very useful block. It is widely used at emergency department, doctor's office, and perioperative settings. There are several approaches. Probably you will see different people have different techniques. So I'm gonna briefly talk about different approaches, but I will focus on the modified web space approach. And also I will talk about how to minimize the pain during the procedure. Let's review anatomy first, which can help us understand how to do nerve block. Okay, digital nerves arrive from median nerve, those green colors median nerve, and ulnar nerve. Median nerve covers 3.5 fingers, and the ulnar nerve cover 1.5 fingers. And the radial nerve, dorsal part, cover 3.5 fingers. This is the orange colors represent the radial nerve. There are 4 digital nerve branches at the base of, at level of the base of finger or toe, okay? And 2 dorsal digital nerve and 2 palmar digital nerve. The dorsal set of nerve runs alongside at 10 o'clock and the 2 o'clock position, while the palm set of nerve travels at 8 o'clock and 4 o'clock position. Okay, based on the anatomy, you probably can block 4 nerves by injecting 4 sides, like 10 o'clock, 2 o'clock, and 8 o'clock, and 4 o'clock. But obviously, nobody does it because you have to inject 4 places, and which can cause a lot of pain. Okay, let's talk about 3-sided digital block. So place patient's volar side hands down, insert the needle at 90 degree, just distal to the MCP joint or the knuckle, like this. Slowly inject anesthetic as the needle advances towards the volar side, and then partially withdraw the needle, and then redirect needle, and cross the dorsal aspect of the finger and inject inject local anesthetic to the lateral aspect of the finger, and then withdraw the needle completely, and the endo entrance on the lateral side at 90 degree, and the advanced needle to the volar side, inject local anesthetics. So this is called 3-sided digital block, 1 side, 2, and 3. So 4-sided, let's talk about 4-sided digital block. It's also called rim block. It's an extension of the 3-sided block. Third injection, after third injections performed, insert the needle at lateral aspect of the digit on the volar side, advanced needle medially, and inject local anesthetic. But this technique is less favored because of potential ischemic complications. Okay, I'm going to talk about transthecal digital block. So place the patient's hand with palm facing up on the table and located the flexor tendon. You can feel the tendon
or have patient move the fingers. And just, this is the palmar crease. This is the MCP crease. So just distal to the palm crease, your needle angle at 45 degree, and advanced needle, and inject local anesthetic. The anesthetic will travel through the tendon sheet. It should flow freely. If you feel the resistance, you should redirect the needle. And the modified technique is at the MCP crease, and your needle 90 degree, like perpendicular to the skin. And once you hit the bone, withdraw the needle slightly and inject local anesthetic. And this block, the advantage of this block is single injection. It's good for the volar site and the fingertips. But if you have some procedure on the dorsal part of the finger, you might have to supplement on dorsal part. Another disadvantage is the volar, the palm side always sensitive. It might cause a lot of pain. Okay, now I'm going to talk about the web space block. First, I'm going to talk about traditional web space block. So you insert the needle at 90 degree of the web space. This is the web space, okay? Web space, 90 degree perpendicular, and then, but the needle try not penetrate, pierce the volar part. Inject local anesthetic, and withdraw needle, inject local anesthetic. The same, then inject same fashion, inject the other side of the finger. Now I'm going to talk about modified web space approach. So your needle entrance is parallel to the hand at the web space, and inject local anesthetic. There is a superficial transverse ligament, or another word is called swimmer's ligament. So once you make the skin well, and your advanced needle like 5 to 10 degree, advanced to the ulnar side, try to aim at the edge of the ligament, and inject 2 to 3 cc local anesthetic. And then withdraw needle partially, and redirect needle like 5 to 10 degree to the palm side direction, and then we'll advance the needle and inject 2 to 3 cc local anesthetic. Do the same thing at the other side, same fashion. The advantage of this modified web space approach, you can avoid damage the nerve and the blood vessel, right? Because your needle is pretty far away from the nerves and the blood vessel. Another advantage is the web space can hold relatively large volume of the local anesthetic. So it will decrease the hydrostatic pressure, which potentially can cause ischemic complications. Okay, I'm gonna show you how I do a digital block. I would call web space technique. So I used needle, 27 gauge, half-inch needle, and with 10 cc syringe, with light, 1% lidocaine. I add like 1 cc bicarb, so 1:10 ratio. This will decrease the pain during the injection. You can also use smaller needle, 30 gauge, half-inch, also works well. Okay, so now I will clean the web space. This gentleman had an injury of his right index finger. Okay, So generally, digital block is very painful, especially inject through the palm side. So you would need to give sedation before you do it. For this technique, it's less painful. Also, I use the smaller needle. The size matters. The smaller needle causes less pain. So this patient doesn't need any sedation. So this is the web space. So you want to do injections to numb the skin, and then want to put the needle under the called swimmer ligament. Okay, and go advanced and aspirate. Make sure the needle is not in the blood vessel, and then start injection. Okay, and the needle angle little bit face to the palm side. So we inject 3 to 4 cc's and then put needle back. And aiming to the dorsal side. And this hand, non-dominant hand, sometimes you hold the patient's, stabilize the patient's hand and use the thumb to feel this space. You don't want to build up too much pressure. Okay, another 3 cc. So now I'm going to inject the other side of the index finger. Suppose make a skin wheel to numb the skin first. It will help the pain. Okay, and then advance the needle. So a little bit palm towards palm side, and aspirate. Make sure there's no blood, and then start inject, and inject. Keep injecting while withdrawing the needle. Okay, then put the needle back. I would go a little bit dorsal direction.
Okay, now I'm going to talk about how to decrease the pain during the procedure, minimize the pain during the procedure, because it's very important. If patient come to your office, you don't want to give sedatives. You want to send the patient home right after procedure. And also you don't worry about patient's NPO status. So you can do this without any sedation. Okay. The first I would do is to use smaller needle. I generally use 27 gauge or 30 gauge needle. The size does matter, because the bigger size causes more pain, the smaller size causes less pain. Second, you can add sodium bicarb to your lidocaine solution. I use 1:10 ratio dilution. We neutralize pH, so when you inject, the solution will cause less pain. Number 3, try to inject the dorsal part of the hand or the web space, which is less sensitive. If you inject the palm side, which palm side is more sensitive, palm side injection can cause a lot more pain. Number 4, when you do the injection, inject slowly. If you inject too fast, it does build up pressure and cause a lot of pain. So inject slowly will cause less pain. Number 5, what you can do is tap the area when you inject. Use your non-dominant hand. Try to distract the patient. It also works. And also your dominant hand, you can tap the area and also feel the area. See, when you inject local anesthetic, the hydropressure will build it up. So you can feel if, you know, a lot of pressure there, a lot of fluid, you probably should stop that inject. Okay, today, so we talk about different approaches to the to do the digital block. I demonstrate how I do the modified web space approach. I think this approach has a lot of advantages. You can do it without any sedation.